Welcome back to Rural Health News. For the next few episodes, we'll be hearing from a variety of guests that will be featured in our upcoming Summit series, which you'll hear more about soon. For each of these guests, we ask them what is most urgent news headline in rural health today. Karen, what is the most urgent piece of healthcare news that you as a CEO, individual leader, are watching right now? And I know there's a lot, but what would you say is right now something that you're opening the papers, tuning into radio talk shows, whatever it is?
Absolutely, hands down, it's the proposed cuts to Medicaid, without question.
Yeah, the Senate bill is awful. I thought the House bill could not be any worse until they produced the Senate. Maybe that's why they produced the Senate bill, make the House bill look so good. But end of the day, it's even deeper cuts that we thought were not even humanly possible. And, you know, we know that, and I was talking to Brian Peters, our MHA president, sadly, this issue of a tax cut has now equaled a conversation about healthcare reform, which it's mind-blowing when you give it consideration of how it's turned so quickly. I mean, of all the places they could have taken to find tax cuts and breaks, who would have ever thought that they would take it from the least among us? Very sad. And I think we have to continue to call it out. So thanks for joining us again today, Karen. It's been great to have you.
Thank you for having me.
I want to ask you a question. And, you know, what would you say is the most urgent piece of healthcare news you yourself as CEO of the hospital? Now, with your background, you know, you got to be worried about some of the challenges that are happening right now with IT and infrastructure and some of the significant challenges of ransomware and all of those things. But I don't want to put words in your mouth. What are you monitoring as a senior leader right now? What's the number one issue?
I think right now the number one issue is this Medicaid legislation. I really do think it is. You know, obviously I go back to my background in IT, coming up in those ranks, and the cyber attacks are always a challenging thing within our, and something that keeps you up at night.
It does.
But right now, I think the biggest immediate threat to care of our community is this Medicaid issue.
I would agree. Thanks so much for joining us today.
Appreciate it.
The question I would ask you, what is the most urgent piece of healthcare news you're watching right now yourself as a senior leader? We've had all kinds of answers, from 340B to watching the staffing ratios. What are you watching?
One thing that I feel a lot of people haven't given consideration to is actually the Grad Plus loan program that's out there for graduate students, because it affects a lot of physicians in training.
That's true.
So the bulk of physicians do rely on the Grad Plus program to be able to pay for medical school. Yeah. We know physicians have a very low default rate, and yet the government wants to cut that, and they're paying back those loans with interest. So it's difficult to say why exactly they're looking to cut that, but it's almost going to gentrify becoming a physician, because we know in rural areas, you either train in a rural area, are from a rural area, or marry someone from a rural area. Yeah. And unfortunately, usually people from a rural area cannot support the north of $250,000 it would take to put yourself through medical school.
Yeah, and so the premise behind it is the government will, if you go and work in a rural community that's been identified in a certain area, they'll forgive what percentage of your loan? So is it all of it? Is it a certain amount? Do you know the specifics?
It's unrelated to the Grad Plus program.
It is unrelated.
Unrelated. Okay. So this is just giving them a loan
to
attend medical school. That's
all. It.
With interest.
So it's not even dealing with coming back. So this is just a loan program.
Just a loan program.
In which they're getting a percentage of, I would think, some type of percentage.
The government, yes. Yeah. I don't know the exact percent, but it's somewhere in the 8% range right now. So it's not a bad deal for the government.
So this is new to me. So I'm interested in hearing this. So this is something that a lot of physicians take up?
Yes. So if you look specifically, I'm a Michigan State grad. At Michigan State, over 50% of physicians in training rely on the Grad Plus loans in order to complete their education.
Wow.
Usually people are taking upwards through just that loan program of over $30,000 a year to support themselves through medical school.
Wow, that's something new that I just learned. Yeah. So advocate.
Absolutely, and that's at the federal level as well. So that's what I'm keeping my eye on as we look forward always to recruiting future physicians.
Now, Kent, we're here talking about some of the challenges that we're facing in this country. And I want to ask you a question. What, as a senior leader, as the president of an organization, what is the most urgent piece of healthcare news that you're closely monitoring today? I have a feeling I know what it is, but we've had other guests this week share 340B. They've shared, other concerning issues that are also important. What are you monitoring yourself as a senior leader?
Yeah, by far the biggest concern that I have right now as a senior leader in healthcare is access for all Americans to healthcare.
That's right.
What we can do.
That's right.
So right now it's the potential for Medicaid cuts that is quite concerning to me.
As should be concerning for all of our listeners on this podcast. So whichever state you're in right now, Montana, Michigan, Ohio, doesn't matter. These are going to be issues that impact you and your communities. Please lift your voices together with us.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.